Hi, my name is Ken Belcher. I'm the President and CEO of CharterCare Health Partners. CharterCare is the affiliation of two heritage organizations, Roger Williams Medical Center and St. Joseph's Health Services of Rhode Island. I invite you to view this video to learn more about our system.
Hi, my name is Chris Godin. I'm a RN in the emergency department at Our Lady of Fatima Hospital.
The labs and the urine was sent, the EKG was done.
Yep.
My name is Audrey Longo. I'm a staff nurse and a charge nurse here at Fatima ER.
Dr. Ty Hartman, emergency physician at Our Lady of Fatima Hospital. And have you had this before?
No.
Are you having any trouble with your breathing?
No.
Good. We left a message with them yesterday.
Okay.
The average shift here, usually we get a report in the morning, taking over care of the patients that were here the night before, the shift before. We establish vital signs on the patient, do assessment ourselves, do any documentation that needs be.
This is a machine, it's a vital sign machine that we would take this into the room, and this is how we get the initial vital signs on the patient. So when you have to get a blood pressure, temperature, and an oxygenation, which is a basic assessment that has to get done on every patient that walks through our doors of this emergency department.
Well, as soon as the patient arrives, they will be initially triaged. And what triage really is for is to just see the level of severity and the rapidness with which they need to be seen.
It's important to keep the patient updated about what's going on with them and their situation, because I don't know if you were ever a patient before, but sitting in a bed sometimes for a couple hours not knowing what's going on, it's very nerve-wracking to be in the emergency room not knowing what's going on with your health.
Have you had any surgeries or operations?
No, I haven't.
Management of the ED, there are different ways to do it. You can have a patient come in and get registered, and then they come in and they see a triage nurse.
No.
So your pain is over here, but it hurts when I touch here?
Yeah.
And at that point in time, her mind is thinking. If it's a belly pain, what does this patient need? Is it appendicitis? Because she's trying to think. She's not diagnosing, she's assessing, because that's what nurses do. Doctors diagnose, nurses assess. So constantly in the nurse's mind, they're assessing the situation, they're assessing the patient, and they're assessing what the patient will need.
One of the frustrations patients have is that they're telling the same story 6 times to 6 different people. They've told it to the registration person, they've told it to the triage nurse, they've told it to their own nurse, now they're telling it to the doctor, or maybe they're telling it to an associate practitioner, then they're telling it to the doctor. We try to put processes as parallel processes rather than as serial, meaning that instead of doing one thing and then the next and then the next, you can do multiple things at one time. Do you have any nausea, vomiting?
No, I do not. It's just really heavy in my chest.
Heavy feeling in your chest.
Yes.
Well, we did an EKG, and so far that looks okay. They get put into a room right away. They get registered at the bedside. The nurse is seeing them, and they're giving their history at the same time the doctor goes in and sees them.
The doctors are at the bedside. The patient's not even on the stretcher yet at times, and the doctor's at the bedside assessing the patient, giving us orders, and getting the process going.
From the beginning, these doctors saw patients immediately. I mean, we don't even make patients wait in the waiting room. Just like if you came in by rescue, we try to make the waiting room the same effect, is to bring a patient right back so that they're seen in a timely fashion.
As the patient's giving some history, the nurse is already drawing the blood, and the x-ray department's alerted that they're going to be doing an x-ray. So you can do things at the same time. And if you can have multiple providers in the room at the same time hearing the story, then it really expedites the care and decreases the level of frustration that patients have coming to an emergency department.
The EKG right here on, you see anything here with a bad baseline?
No, it looks like it's pretty normal. I don't see any problem. I don't see any.
The EMA docs have brought great changes here.
Yeah, Our Lady of Fatima is a community hospital that has a lot of services available 24 hours a day. We see everything from heart attacks, strokes, abdominal pain patients, children, adults. We see everyone basically, and that's typical. If someone requires a higher level of care that we're not able to provide, we will find that care for those patients and treat them appropriately.
It's a very caring environment. We try to care for the patient from the minute that they walk in the door until the point of admission through discharge.
A good staff attitude is when everybody's working together, nobody's feeling overly stressed. Your nurse is kind to you, compassionate, and that's pretty much what nursing is, being compassionate and caring towards your patients. And we have a lot of that here.
This is a challenging time for healthcare, not only in Rhode Island, but regionally and nationally. And the challenges will continue as legislative changes are made and come upon us. CharterCare is well positioned for these challenges and these changes. We welcome you to contact us to learn more about our system. Feel free to contact me directly or any of the members of our team. We would love to talk with you more about CharterCare and all the services that we have to provide.